Good afternoon. Thank you for tuning in to our live briefing for Friday, April 24th. We have a number of things to share with you today. After I'm finished, you're going to hear from Deborah Jacobson. Then we will have our fun Friday feature with Tracy DeVera from Recreation. And lastly, David Curtis will have some scripture and a poem for you. I want to remind everyone there'll be no live briefing tomorrow, Saturday or Sunday. But we will be back at 3 p.m. on Monday with another live briefing. First up, just real quick, the numbers. I like to share those every day. But the COVID-19 situation in Virginia, overnight, the number of tests went over 69,000. We had nearly 4,500 people tested yesterday, which by far was the biggest day of testing we've had so far. Cases, just right at 594, up 596 from yesterday. Hospitalizations at 1,837, and deaths, we had 38 deaths overnight to bring the number to 410 in Virginia. We hear from many of you that you're ready for this self-quarantine situation to end. While we are eager for this situation to end as well, we are not at the end of this pandemic, and we will not ease up on our campus procedures early. We can't let our guard down about gathering in groups, and we need to maintain strong behaviors relative to social distancing, keeping our hands clean, away from our face, those sorts of things. There are an increasing number of outbreaks of COVID-19 in Virginia. Currently, as of today, there are 98 senior facilities in Virginia with active outbreaks. An outbreak means that there are more than one case, two cases that are community spread. So they were spread within the facility to more than one individual. 98 facilities in our state have that situation happening right now. They amount for over 1,000 cases and have accounted for over 80 deaths. This is not something we wish for anyone, and we certainly don't want this to happen on this campus. And so we need to understand as a group of individuals that the COVID-19 situation in senior living is getting worse right now, not better. As an industry and as a sector, we're trailing the outside world. People outside, staff and others, have this disease, and it's just coming into communities now, and it's beginning to spread. So we cannot become complacent, and we can't let our guard down. What we've been doing is working, and we want to keep it that way. As the country begins to consider reopening, Westminster Canterbury Richmond is going to take our guidance from the President, the Governor, the CDC, and VDH, like we have since the beginning. We've applied an abundance of caution. We were early into these measures, and we're going to be late coming out because we want to keep everyone, both residents and staff, safe. The President's plan, it's called the President's Plan for Reopening the Country, is very vague. But what is very clear in that statement, it's a three-phased reopening, is that senior living would be in the last phase of reopening because of the vulnerability of the seniors in this country to the virus. The governor made his blueprint public right before I came on today, and I listened to some of it. You'll be pleased to hear that he had technical difficulties too, and no one could hear him for the first 20 minutes of his presentation today, but he was able to actually share it later this afternoon. The governor said that for us to reopen, and I thought this was very poignant, and I think it's right. For us as a nation and as us in Richmond, for us to be comfortable with reopening, both customers, in this case residents, and staff need to feel safe, or it won't work. And we're not there yet. Until we have much better access to testing, I don't think we can move to reopening yet. It's getting better, but it's not there. And the governor made that case very clearly today, that first things first, we have to get testing ramped up so that everyone can be comfortable with transactions. And transactions meaning person-to-person kind of relationships. We're not there yet. So more to come, but we're going to sit tight and we're going to get through this. Changing subjects a little bit. Yesterday, I participated in the second meeting of the Governor's Long-Term Care Task Force. The main topics yesterday were really twofold. First, financing, and the second, testing. As you would expect, this pandemic is very expensive for long-term care organizations, especially those where there's been situations where outbreaks have occurred. In order for these organizations to provide adequate care, they're having to bring in lots of extra equipment, lots of extra staff, and they've got a lot of staff that are sick, and that's very expensive as well. So lots of discussion about that. Other organizations around the Commonwealth are going through that right now. And so the governor's team is working on how to get extra funding to the Medicaid nursing homes and to help all of us pay for the costs associated with this situation. The second topic, testing, is also very challenging for long-term care organizations because we're dealing with sick individuals. We're caring for people with COVID, and we've got staff with COVID. And so the need to test is real, and it's timely. We need to be able to get our staffs tested. In some parts of the Commonwealth, testing is still very hard to access. For us, we've had better access for the last 2 weeks, but it's still challenging in terms of getting folks back to work and to get a resident to the point where they're well. The focus of yesterday's task force call, though, was really more around getting consensus as an industry about the idea that hospitals must test all their patients before they discharge them, which it sounds as if that's not been a practice across the Commonwealth, and that in some municipalities, hospitals have been discharging seniors back to senior living communities, or to the broader community, having never tested them, whether they had symptoms or not. And we're, as an industry, needing to take a position that everyone needs to be tested. It's clear we're not going to be able to keep people in the hospital until they're recovered, but we do need to know whether they're positive or negative when they come back to the community. Many of these outbreaks have happened because independent living residents have gone to the hospital for something and not gotten tested, come back into the community positive, and spread the disease, ended up in healthcare, and the situation from there has gone bad. So that's not been our situation. We've been able to get pretty much everybody tested, and we're in a fortunate situation. We have great relationships with our hospital partners, and our hospital partners are leaders, being VCU and Bon Secours and HCA. They've all taken very strong positions. In other communities, that's not been the case. So thankfully, the situation that we sort of heard about on the call yesterday has not been our experience, but it has been very challenging for other organizations. Just last thing about that, the governor's task force, I've been assigned to the Infection Prevention and Personal Protective Equipment Subcommittee. I know that sounds exciting. We'll have our first subcommittee meeting next week, and I'll learn more about what my participation in that will mean. And I'm eager to get involved. It's a very good group. It's really it's an astounding group of professionals from the top to bottom in terms of the people that are participating. Last thing for me is I want to thank each and every one of you for your care and the concern you've had for the residents who've been sick and our employees who've been ill during the COVID-19 pandemic. As you know from watching every afternoon, we've had 4 employees who've tested positive for COVID-19. All 4 of them now, have received their 2 negative test results, which means they are now fully recovered and able to come back to work. And as you know, we don't share the identities of those individuals who test positive so that we protect their privacy. But we are welcoming one of those employees back today. And he's joining us this afternoon to say hello and thank you to you. So let me introduce you to Security Officer Romaine Coles. He wants to speak to you.
Thank you, John. On behalf of the Security Department, I just want to let you know I am back. A lot of employees asked me how did I feel when I came back, and I told everybody that I'm back at 200%. I just wanted to take this time to thank everybody that called and that supported me while I was out, checking on me. My family definitely also wants to send their thank yous also. It's good to see that the Westminster Canterbury Way can even extend out when those that are recovering are trying to recover. So this is a personal thank you that I want to give to everybody. And just always keep in mind to wash your hands and maintain your 6 feet distance. And let's everybody play our part. And thank you once again. And now I'd like to turn it over to Deborah Jacobs.
Good afternoon. We are so thrilled to have Romaine back with us. I want to make a few announcements on this beautiful Friday afternoon. The first is a thank you for your participation with UCrops. The UCrops company partnered with us, and as of today at Azalea, 20 orders for delivery are being delivered. They are thrilled, and they want to recommend to you to continue using their services. And there is one change. There's a change as far as the link that you'll be using. This is to make it a little bit more convenient for our residents, and this will be publicized in the Touchtown app. But I'll just tell you real quickly, it's ucropshomestylefoods.com/shop/. And that will get you to that area where you order your food a bit quicker. Absentee ballots. Just want to let you know that the post office box that was listed for the residents that vote in Richmond City was posted in the tails incorrectly. The number is 61037, and that will be posted in the tails this coming week, but we just wanted to let you know on the actual application it is correct, so you shouldn't have any problem with that. The applications are available to you at the Tower Information Center and the Business Center in the courtyard. We'll continue to replace copies as they are used, and this applies to the dual primary election on June 23rd. If you have any questions, please contact the Resident Services Office or your social worker within your area of care. It's so important for you to be able to reach out and talk with your family, and we know you do that by telephone, but we'd also like you to have the opportunity to actually see them. In order to do that, we are recommending the use of FaceTime and Skype. These two apps have been used by our assisted living and healthcare staff for a while now, but we have some independent living residents that also would like to participate in that program. Our IT staff have agreed to help you with that. We ask you to call 4026 and set up an appointment 24 hours in advance, and they will contact you and let you know exactly where they'll meet with you and get you in touch with your families. A big thank you to Kathy Morton, our volunteer resource administrator. Kathy has helped us all week long celebrate the Volunteer Week. National Volunteer Month was this month, and this week Kathy made it extra special for those staff members that are volunteering and also making sure our residents know how much we appreciate them. Unfortunately, we weren't able to do a lot of celebrating like we normally do with the residents, but don't worry, we'll make sure we have that happen in the future. Mask. The cloth masks that many of us are wearing are available to residents. Many of you have called the Resident Services Office and have ordered one or picked up one or had one put in your box. Please keep in mind that we only have one per resident in order to service all of our residents. If you do need a cloth mask, please call 6082. Last but not least for me today, TV 970 programming. We have made several additions to our programming, and we've heard lots of compliments about that. Unfortunately, the tales that went out this week, everything is already out of date for the programming that we just changed. So starting yesterday, there is a menu version for each day just telling you exactly what's going on, and in the future we plan to enhance that into the tales as well. So that's all from me today. I hope you have a wonderful weekend, and now we're going to have some fun, and I'm going to turn it over to Tracy DeVera.
Hello, everybody. I'm Tracy from Recreation. Fun fact, right before I started working here 14 years ago, I had just gotten back from visiting my sister in Hawaii, and I danced the hula. And hula is the dance of Hawaii, and a lot of people think I'm Hawaiian. I'm not Hawaiian, but I do love to dance the hula. And today, I hope that you join me. The hula is a lot of fun, and it's a great way to get moving, and learning something new is also great for your mind. So if you could join me in your apartments, you could stand up if you can, and put your feet about shoulder width apart. And you'll want to keep your heels on the floor, and you will relax your shoulders and, of course, relax your hips, and you'll slightly bend your knees, but you'll keep your core tight, okay? All right, so now that we're in position, this will be our warm-up, and my teacher growing up would call this the fruit salad, and I will show you why in a minute. So you're gonna take your hips and you're gonna go to one side, and we'll call that apples. You'll go to the back, oranges. To the other side, bananas. To the front, pineapples. Apples, oranges, bananas, pineapples. Go all the way around for fruit salad. All right. When you feel ready, you can reverse it, and you can do each fruit one at a time. Or you can go all the way around for fruit salad. Now, the real term for this is called the ami, all right? And you can go as big or as small as you feel comfortable. Okay, now that we're feeling a little bit loosened up, we're going to take a step and go side to side. So you're just going to step side to side, all right? Good. Now that our hips are loose, you're going to add in your hips, and they're just going to sway a little bit. They're pretty much going to make like a figure 8, but just have them nice and loose. And the next step is a double step, which you've probably seen before if you've seen the hula danced. You're going to do step, together, step. And the same thing the other direction. Ready? Step, together, step. Again, keep your knees bent and loose so your hips can be loose. We'll do it again and add the hips. Step, together, step. Step, together, step. So I picked a song for us to do together today. I think a lot of you will know it, by Don Ho, called Tiny Bubbles. It's funny, when I started dancing the hula at 8 years old, I had no idea that it's tiny bubbles in the wine. But I know that the song will keep repeating, so you'll just do it with me. You're going to do tiny bubbles like you're popping 3 times. Other way. And then you're going to clap in the wine, like drinking. Makes me feel happy. And then you're going to do the ami, makes me feel fine. That is going to repeat throughout the song. So I'm going to have the song play. We'll do that part together over and over. There'll be other parts of the song that you'll just be able to follow along. Don't worry about getting your feet correct. Just keep moving those hips and try to do the arms with me. Are you ready? We're going to step side.
Tiny bubbles and wine make me happy.
Go. Wiggle your fingers.
Make me feel
Keep your hips going.
fine.
Very good.
Tiny bubbles
Arms up.
make me warm.
Warm all over. The arms go up.
Well,
Feel your arms in front of you. Basic step. This part's different, just follow.
Here's to the
Golden moon goes up. The sea, we're gonna make waves.
And here's to the silver sea.
Basic step.
And mostly here's a toast
You're gonna point
to you and me.
and point again if you'd like. Tiny bubbles again.
Tiny bubble. In the wine. Make me
Happy?
happy.
Keep the hips going.
Make me feel
In a circle, that fruit salad or that ami. Tiny bubbles.
Make me
Warm all over, arms up.
with a feeling that I'm gonna love you till the end.
Basic step. Tiny bubbles again. I think you got it.
Ooh, I'll leave
If you want to add, you can move. Ami, circle, fruit salad. Tiny bubbles. Warm all over, arms go up. Good. Good. Basic step. We're gonna do the feel again. Just stay right here. Basic step. Almost to the end. Doing great. Keep going. Then we're gonna bow here. And thank you so much for joining me. And next, I have up David Curtis from Pastoral Care.
Good afternoon, everyone. I'm David Curtis, one of the chaplains here at Westminster Canterbury. A couple programming notes really quickly from Pastoral Care. We will show a sermon for every Sunday, this coming Sunday at 4 o'clock on TV 970. The Reverend Dr. Kristen Atkins Whiteside, who is the senior pastor at First Baptist Church in Winchester, Virginia, will preach on the gospel reading of the road to Emmaus. So please tune in on Sunday at 4 o'clock on TV 970. Additionally, chaplains are now leading services from our chapel at 10:30 every Thursday. While we can't be together in person just yet, we can join together in worship as the service is televised on TV 970. Bulletins for the service will be included in the tales, which you will receive on Wednesday. Also beginning on Monday, the 27th at 6:30 on TV 970, we will show our service of evening prayer Monday through Saturday. And again, that's at 6:30 on TV 970. Hear these words of Scripture today from 1 Kings chapter 19, verses 11 through 13. God said to Elijah, "Go out and stand on the mountain before the Lord, for the Lord is about to pass by." Now there was a great wind, so strong that it was splitting mountains and breaking rocks in pieces before the Lord. But the Lord was not in the wind. After the wind, an earthquake, but the Lord was not in the earthquake. And after the earthquake, a fire, but the Lord was not in the fire. And after the fire, a sound of sheer silence. When Elijah heard it, he wrapped his face in his mantle and went out and stood at the entrance of the cave. Then there came a voice to him that said, "What are you doing here, Elijah?" The word of the Lord. Thanks be to God. This afternoon, in place of a prayer, I would like to offer you a poem that was written by Jane Honeycutt, a friend of mine and a member of St. John's Episcopal Church. The poem is entitled Pandemic Room. I sit alone in this small room and try not to count the hours, the weeks I've been here. I imagine a similar room far from here where an Italian woman grieves. A similar room in India where a child is confused by the stillness. A room in Scotland where a man reads. Across the street, my neighbor sings. In all of these rooms, we have moments of joy and moments of gratitude. In the room, we each pray for the sick, for the helpers, for the hungry. These prayers bind us more tightly than touch. One day in the future, it will be safe to leave. We will walk out into the sunshine towards one another, our arms outstretched, saying, I know you. We have come from the same room. This day and evermore, may we all find and be found by God in the stillness of our rooms and in the silence of our hearts. We will soon enter into this holy time of Sabbath this weekend. Shabbat Shalom to everyone. Thank you for joining us today. Please join us for our next update on Monday at 3 p.m. Thank you.